is it's important for you to begin to take steps now in managing your mental well-being. Allowing it to go untreated for long periods of time creates a greater difficulty for mental health professionals to help you get better quicker. So, when do you look for immediate help? When should you call immediately? If you're thinking of hurting yourself, this includes suicide, but it also includes self-harm behavior, cutting, clenching your fists so tightly that your fingernails dig into your palms, pulling hair, things of that nature. If you're finding that you're physically having to damage yourself in some way to help deal with the emotions, then definitely you need to get immediate help. If you're thinking of hurting someone else, if you believe that you or your family are in danger, the other thing that we don't always pay attention to is when you're feeling overwhelmed, when you feel overwhelmed by sadness, depression, anxiety, hopelessness, all of those types of things. So this slide lists some phone numbers to call. 911 is at the top of the list. Also, the National Suicide Prevention Lifeline. SAMHSA has a disaster distress helpline. And there is a text line for people who are more comfortable with texting rather than talking. We've included some domestic abuse and child abuse numbers on here as well, because the stay-at-home orders have likely increased the stress in the home environment. And we know from previous experiences that increased stress at home increases domestic violence and child abuse if it's not mediated well. So that's when you seek immediate help. But what else do you need to pay attention to? When might you want to go to get further mental health treatment that maybe is not quite so immediate, but it does need to be taken care of? When it interferes with your ability to function. If you're at work, if you're at home, you're not able to do things, that's a time to consider getting mental health treatment. If it lasts for several weeks or longer, if it gets worse, and again, if it becomes overwhelming, and I'm not talking about overwhelming today, I'm talking about where you find yourself just not being able to function. So signs of that include the confused thinking that we talked about, the signs of depression, excessive eating, excessive sleeping, or the opposite of those, not enough eating, not enough sleeping, not enough hydrating, extreme highs and lows, where you find that you're really super fearful beyond what is reasonable, social withdrawal, and denying of your obvious problems. Substance abuse is a very good early indicator of increased stress. So where are you going to go? How are you going to find mental health treatment in your community and in your area? Well, one of the first people to talk to is your primary care provider. They will have access to mental health professionals in your area, and they may know some of them personally. Your human resources department may also have employee assistance programs developed. I also am aware of several hospitals that have had counselors come in at change of shift to help nurses deal with what they're experiencing on these shifts. Your insurance provider may have a list of mental health professionals in your area. SAMHSA has a hotline, and there's also, in most communities or counties or parishes, in my case, community mental health centers. So what should I do? The first thing to do is to pick up the phone, to make a call, to schedule an appointment. That seems to me to be one of the most difficult steps for many of us when we're trying to recognize that it's okay for us as nurses who are caregivers to seek care ourselves. After you schedule the appointment, spend some time writing down what's going on, preparing for your appointment. What are the things you want to discuss with the mental health professional? And when you get there, recognize that it's not going to get better overnight. Part of working with your mental health treatment is building a relationship. Find somebody that you really relate to, because one size doesn't fit all. One type of approach doesn't work for all of us. Find somebody that you feel like you can have the rapport that you need. So the tools to help, APNA is in the process of developing a self-assessment tool, and we anticipate that that's going to be out in the very near future, and we will put links to that with all of the different organizations that are listed on this slide. Also, there's a mental health support and services guide for nurses that will be coming out soon. So keep in touch with your organizational pages. They oftentimes will have information for you that will help. You might also touch base with your schools of nursing.